Later on, once again, thank you, Valentin Chernyshov, Stop Pain UA.
And dear friends, the last topic, before we are going to invite you to get the lunch, with huge pleasure we are going to talk about the usage of nanotechnologies for stable non-drug pain treatment and management. Let me represent Rhett Spencer, the Science of Technology of Pain Management nCAP. Rhett and Tony were unable to be present with us here physically. Tony, who is the channel director of nCAP Technologies. That's why I'm going to give a floor to Jarvis, who is an employee of the company. Jarvis is with us at this moment of time.
I'm the Chief Marketing Officer for August Mission. Mostly I've been managing the conference in the back with our conference coordinator, Lena, but I'm standing in front of you now to represent the nCAP team. The nCAP team I'm representing is comprised of Rhett Spencer, the inventor, and Tony Sutera, President and CEO. Unfortunately, they couldn't be with us today since they're en route to Germany for the Medica Trade Fair, which is a hub for cutting-edge medical technology, and they will be showcasing there throughout the next week. On their behalf, I am thrilled to share nCAP Medical to you, an innovative company based in Eber City, Utah. Each of you has already been provided with nCAP's pioneering product, the NeuroCouple pain relief device, which is comparable to the size of your mobile device or even smaller, like the size of a napkin for your coffee. There was one on every seat yesterday, and we still have many extra samples in the front rows of seats, and Bruce here has a bag full of them to distribute. And some of those that were used even last night by some of the folks here yesterday, some who were experiencing some pain and able to apply it, use it, and feel relief immediately. Rhett and Spencer, even though they couldn't be here, did prepare these slides to elucidate the mechanics and efficacy of the NeuroCouple. And you can access further details on their website, painrelief.io, which you can see on the device itself. Beyond their commercial adventures, nCAP is committed to global well-being through their humanitarian work with Pain Relief International. For a deeper insight into their mission and contributions, please visit painreliefinternational.org. Medical professionals encouraging and understanding and engaging with emerging medical technologies is crucial. And I think these next few slides will certainly provide you with insights into the forefront of pain management solutions. The NeuroCouple pain relief device is a breakthrough in non-pharmacological pain management. It employs advanced nanotechnology to modulate the body's pain signals, potentially revolutionizing how we approach pain therapy. What's fascinating is that these devices are free from drugs, herbs, or any need for a power supply. They're engineered to work perpetually and non-invasively, even through layers like clothing or bandages. Nanotechnology is changing lives. It's used in electronics and materials, and the nCAP team has applied it to pain management. When we experience pain, whether it's inflammation, nerve damage, injury, the body creates imbalanced electrical signals that are then transported to the brain and interpreted as pain. What is in each NeuroCouple device are billions of nanocapacitors, which interface with those imbalanced electrical signals for pain relief at the point of contact. Each NeuroCouple device has nanocapacitors that work through a method called capacitive coupling. The way capacitive coupling works is by transferring electrical energy between two components without a direct connection, utilizing the electric field and not interacting with the magnetic field. When somebody uses NeuroCouple, the two components are the body and the device. And the energy is the imbalanced electrical signals that normally tell the body, this is pain. So normally cell membranes are biological capacitors, and you have a natural balance of electrons and electrically charged molecules on both sides of the membrane. With trauma, you get damage to those cell membranes. And with damage, you lose that natural balance. Electrons increase, negatively charged molecules and fluid buildup. All that causes pain. So the NeuroCouple device effectively substitutes for damaged biological capacitors. It facilitates the transfer of these imbalanced charges, and it does it more efficiently than a cell membrane. And that restores the natural electrical balance of the area. So if there's no pain, there's no imbalance of energy. Then there's nothing to activate, and the neurocouple device simply not active. So as far as evidence, I'll provide general context behind the data presented here as a non-medical professional myself and presenting on behalf of Rhett and Tony. I, Jarvis, had to do a little bit of research here. BPI is an acronym for Brief Pain Index. The BPI is basically a brief and easy to use tool for pain assessment. It uses a simple rating scale from 0 to 10, so very easy to understand. The scales and scores of the BPI are also quite easy to translate into other languages. BPI severity is asking patients who had experienced pain in the last month to rate their pain intensity. Worst, average, now, scale of 0 to 10. The BPI interference score measures how much pain has interfered with 7 daily activities, including general activity, walking, work, mood, enjoyment of life, relations with others, and sleep. So BPI pain interference is typically scored as the mean of these 7 interference items. And in an observational study of 66 patients, you can see dramatic decreases in both BPI severity and BPI interference, 71% and 67% respectively, without side effects and preference over oral medication. And there are similar results for a post-surgery study as far as reduced pain scores. As far as application, you can apply the device everywhere. Feeling the pain on your back? Place it on your back. On your arm? Put it on your arm. It can be on top of the skin, but it doesn't have to be. You can put it on top of your clothes or bandages. You can use it for a long time. There are no concerns for overuse. There are no side effects. You can keep it in place with a wrap if you'd like, but you'll also notice on the back of this, there's a Velcro backing, right? So you can use it with clothing. The device is sustainable. It is washable, shareable. You can reuse it for years. So in the past few slides, we've seen all the advantages. It's a physical device. There's no intake. There's no side effects. It's easy to use. You can put it on top of clothing, bandages. It's shareable and sustainable. It is applicable for all types of pains. There are some non-obvious applications. Temporomandibular joints, TMJ, you can apply the device to jaw joints and surrounding muscles and ligaments. You can apply it for a frozen shoulder, migraine headaches, phantom limb pain, for amputations. A quick slide on regulatory and safety information. The neurocouple device is registered as a medical device in both the United States and the European Union. In China, it's pending registration, and it also has the CE safety mark. As far as the future, nCAP is exploring embedding of these nanocapacitors into other medical devices, prosthetics, gloves, footwear, liners. Other potential applications of the possibility of improving diagnostic equipment, seizures, burns, tumor detection. But really importantly, nCAP wants to collaborate. They'd like to be in contact with any of you for ongoing research, gathering feedback, and collaborative opportunities. For that purpose, we have the nCAP team's email addresses, which I'll share at the end. Using a device like neurocouples is an extremely valuable option to reduce consumption and reliance on pharmaceutical products, for example. The fewer pharmaceutical doses patients are taking, the less we have to worry about possible side effects, and the higher the prospects for better long-term pain relief solutions. At August Mission, we are a humanitarian aid organization, and at the summit, we have invited many other aid organizations to participate here in the International Healthcare Summit. Similarly, nCAP Medical partners with charity organization Pain Relief International to distribute this neurocouple solution. When possible, Pain Relief International would like to partner with local organizations for distribution. Funding for partnership and distribution comes from grants and donations. And you can see the website here at the bottom, painreliefinternational.org. Bringing nanotechnology, specifically nanocapacitors, to the area of pain management especially one that's easy to use, sustainable, portable, and safe without side effects, you can see how that opens up a world of possibilities. Here are Tony's and Rhett's email addresses. These slides are also in the virtual booth for Pain Relief International in the Hopin platform, the website for which you should have received an email from Ring Central. When you click on that, you are dialed into the virtual platform for the summit. And in that Hopin platform is also where you're able to find video replays of all the presentations. So yesterday, we heard from Aspici and their VR technology. Earlier today, we also heard from the Pergo Pouch device for localized and sustained drug delivery. And now you've heard about this innovative neurocouple pain relief device. Before we break for lunch, I want to take a moment to describe a late but fantastic addition to our program, the Innovation Forum this afternoon. The Innovation Forum will also feature similar innovative medical devices and technologies. Companies from the United States will be joining us via Zoom to share with you their amazing products. Similar to nCAP, these companies are also looking for partnership opportunities with you, all here in Ukraine, for testing and distribution. I'm really looking forward for these companies to present, and I hope you are as well. Thank you.
Дякуємо, пане.
Thanks a lot, Jarvis. Thanks a lot for presenting the device, which was created by Rhett Spencer. And maybe I think that to establish the questions are needed to be addressed to Rhett, as far as I assume. But in case you have this opportunity to answer, Jarvis, we are going to wish everybody to have a lunch right now, and we are going to wait for the next lectures and for next discussions. Please, let's have a lunch break, and we are going to hear